If you're currently enrolled in Medicare and you want to know about the changes that have occurred over the last year in how much it costs, the deductibles, the out-of-pocket expenses, this video is for you. I'm going to go through piece by piece to make it as easy to understand as possible and what we need to know from 2023 to 2024. And there's a lot of noise out there, sometimes some misinformation that can really get us confused and make things more difficult to understand. So I'm going to go through everything piece by piece so that we understand exactly what we're doing. I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices, and I can absolutely help you as well. If you find this helpful, hopefully you will, make sure you subscribe to my channel because I put out videos on everything Medicare now and down the road when you're going to need to know these things. So just subscribe now and make it easy to understand as we go along. So I'm going to jump in right now. So we're going to go through Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. So they break it down into different pieces, and we just need to understand exactly what we're doing. So Medicare Part A, pretty easy. It covers stuff that happens inpatient in the hospital. So this is only for if you're admitted inpatient into the hospital, does Part A cover expenses. And Part A has a large deductible. So in 2023, that deductible was $1,600. Big deductible. 2024, it went up to $1,640. Again, not a big increase, but still a big deductible. Something also to understand about this deductible, it's not an annual deductible. It could happen multiple times during the year. So it is a per occurrence deductible. There is a 60-day window, which is called a benefit period. So if you go to the hospital and then you leave the hospital and you're readmitted for the same situation within that 60-day window, you would not have that deductible again. If you go in the hospital and you're readmitted after that window or for a different situation, you would have that deductible again. So certainly really important to understand that. Now the good part to understand is if you have a Medicare supplement, so if you're on Medicare Original A and B, you'll likely have a Medicare supplement. I would absolutely recommend that that's what you try to do no matter what, is to stay with original Medicare. It's really, really good coverage. And if you have a supplement, very low out of pocket. So most all supplements cover that deductible on inpatient admission. There's really no out of pocket expense if you go into the hospital under original Medicare Part A with a Medicare supplement plan, G or N, or if you already have F, you're not going to have any out-of-pocket expense whatsoever. So fantastic coverage going into the hospital. Something else that falls under Medicare Part A is skilled nursing coverage. And this can be confusing to some as well. And there's some things we need to understand about it. Skilled nursing coverage is not long-term care by any means. So Medicare does not cover long-term care. This is strictly for rehab after a hospital admission. And it's important to understand how that is defined because a lot of times people will go into the hospital, even if it's something serious, and the hospital shows them as observation, not inpatient admission. So skilled nursing coverage is not covered under observation, only after a 3-day inpatient hospital admission. So you need to make sure the classification is correct if you're going to qualify for skilled nursing rehab. So if you had a knee injury or hip replacement, whatever it may be, and then obviously once it's done, you're not necessarily ready to go home. You need rehab to be able to walk again and things of that nature. If it's listed under observation at the hospital, it's not going to qualify for skilled nursing care. And that could cost you up to $300 a day at the skilled nursing facility. So just important to understand that the difference between observation and inpatient hospital admission. You have to have 3-day inpatient hospital admission to qualify for Medicare to pay for skilled nursing coverage. Okay, so let's jump into Medicare Part B. Medicare Part B is stuff that happens outside the hospital. Doctor's visits, outpatient, therapy, all that kind of stuff. Anything outside of hospital inpatient admission is covered under Part B. And again, I don't know why they segregate this stuff. And A and B are funded differently from the government. So they get their money from different places. So it'll certainly be interesting when we get down the road a little bit and Medicare is facing some financial challenges, how they're going to fund the Part A versus the Part B. But that's certainly for a different video. But Now, the out-of-pocket expenses on Part B, we need to understand as well what it's going to cost us when we use Part B, the out-of-hospital kind of stuff. It has a deductible. It also has co-insurance, so we need to understand exactly how that works. The premium for Medicare Part B in 2023 was $164.90. In 2024, it went to $174.70, so certainly an increase in that premium. And important to understand how the premium works is if you're already drawing Social Security, they're going to take that out of your Social Security check. So it's going to come automatically out of your Social Security check. If you are not drawing Social Security, they're going to send you a bill. And they're not going to send you a monthly bill. They're going to send you a quarterly bill. So you need to prepare for that. If you're not drawing Social Security, they're going to be looking for 3-month payment of that Medicare Part B premium. Now, you can go on to your My Social Security account and set up a monthly payment scenario, but initially it's going to come as a quarterly bill, so we certainly want to prepare for that. Now, there are out-of-pocket costs for Medicare Part B when we go to use it. So when we go to use Medicare Part B, there is a deductible and there's also co-insurance. And for the most part, Medicare supplement plans do not cover the deductible. A Plan F, which was available previously but no longer available, does cover the deductible, but now Plan G, Plan M, they do not cover the Medicare Part B deductible. The deductible in 2023 was $226, not a big deductible. In 2024, it has gone to $240, also not a big deductible, but it's still a deductible and it's an out-of-pocket expense. So we need to understand when we go to use Part B. So if we're going to the doctor's office or outpatient, anything outside that hospital admission, we're first going to pay that $240 deductible. The doctor should be able to see within Medicare where you sit with your deductible, so they will likely collect it at that doctor's office visit. So just understand we're going to pay that first $240. Good news is it's annual, so it's not per occurrence. It runs January to January. So you're going to pay that first $240, and then next January it's going to reset. And again, it'll likely go up a little next year as well. So just understand that out-of-pocket expense is going to be on us no matter what. And then Medicare Part B is 80-20 coverage, meaning they're going to pay 80% and you're responsible for 20%. So if you're going to a $100 office visit and they pay 80 and you're responsible for 20, not so big a deal. But if all of a sudden something catastrophic comes along and that bill is $100,000 and you're responsible for $20,000, that's obviously an issue. But a Medicare supplement plan, for the most part, covers that 20%. So for instance, if you have Medicare A and B, original Medicare with supplement plan G, your only out-of-pocket expense for the entire year for medical would be the deductible on Part B, $240. That's pretty fantastic coverage. So that's what we try to do, is put you in position where you have low out-of-pocket expense. You can go to any doctor, any hospital, anywhere in the country that accepts Medicare. And that's why I always recommend doing whatever you can to stay with original Medicare Part A and Part B. It just makes life so much easier. So we jump right now into Medicare Part C, which I don't even know why they call it Medicare, because it's not. It is Medicare Advantage, and again, has the name Medicare attached to it, but it is not Medicare. It takes you off of Medicare and puts you into a privately run insurance plan. So something that is run by a private insurance carrier, a Medicare Advantage plan. It may be very similar to what you've had at work. It could be an HMO plan, could be a PPO plan. It can be much more restrictive and make you jump through a lot more hoops than original Medicare with a supplement will. With original Medicare, literally, if your doctor says you need something and you agree and it's medically necessary, that's it. Medicare covers it. They do not require pre-authorization or proof from a doctor that you need this or that kind of situation like a Medicare Advantage plan does. Medicare Advantage, again, is a for-profit situation on your health care. And a lot of times you need pre-authorization to get something done. A lot of times it's denied. I certainly don't want that. If I'm facing some kind of significant medical condition, I don't want to ask for permission to have it done. And that is exactly what a Medicare Advantage plan entails. It also has a network of doctors, a network of hospitals that you generally have to stay within. And a lot will tell you that they have out-of-network benefits, but what you find if you want to go out-of-network, that the cost is prohibitive, meaning it's much too expensive out-of-pocket-wise to use out-of-network benefits. So you are forced back into that network of doctors, network of hospitals. It's just not a situation that I would want to be in with my medical coverage, certainly as I get older, and we're certainly going to need it on a much more regular basis. So I prefer the freedom, the flexibility, everything that original Medicare has, low out-of-pocket costs when you use it with a Medicare supplement plan over the more restrictive type with a Medicare Advantage plan. But it's there as a choice, so you need to understand exactly. I'd love to tell you the differences between 2023 and 2024 on a Medicare Advantage plan, but they're all completely different. So you can't compare apples to apples, and you don't necessarily know what has gone up versus what may have stayed the same, or what benefits may not be there, or what doctors may not be there that were previously. And that, again, it's just so convoluted that it just makes it more difficult, and you don't want to be hitting that head on. You know, you could be in a catastrophic type situation medically, and all of a sudden your doctor leaves the plan or your hospital leaves the plan, and you have to start literally from square one with a new doctor or in a new facility. And that just would not be something that I would ever want to have happen. So just certainly parts to understand with Medicare Advantage and how they function. There are a number of other reasons why I would never choose Medicare Advantage. The doctor network, the fact that they leave the plans quite frequently. You could be in the middle of procedures and all of a sudden either your doctor or your hospital leaves the plan, and you in essence have to start from square one, which would be just unbelievable in my opinion if you were in the middle of cancer treatments or whatever it may be. You know, even a joint replacement, hip operation, knee operation, whatever, and all of a sudden your doctor or the hospital leaves the plan and you can no longer go to see them. You have to change in the middle of treatment. That would just be beyond the pale for me. I would not want that. And again, original Medicare supplement, you don't have any of that. You don't have any problems when it comes to what you want to do. If your doctor says you need it and you agree, it's covered. If it's medically necessary, it's covered. Medicare doesn't get in the way. The supplement plays no part in the decision-making of a recommended procedure. They can't deny it. If Medicare covers it, they have to cover it. So it makes things just much easier. So Medicare Part C is convoluted. If that's where you're going to go, you have to really make sure you understand what is being offered to you, what your options are from doctors and hospitals and things of that nature, and how it affects you if you travel, because it can be a real significant situation when you travel. It may not cover things outside of your service area with the exception of emergency coverage. So just understand that quite clearly. So we're now going to move on to Medicare Part D. Part D is Medicare drug coverage. This is also kind of confusing, and it's going to change kind of significantly in the future. We're going to see exactly how things play out into 2025. But in 2023, it's reasonably similar to 2024. There are different drug plans, and really the way to find one is, the best way is through Medicare.gov. They have a drug plan finder tool. It's actually very good. I have a video that walks you right through it. But this way somebody doesn't sell you a drug plan that might not be the best drug plan for you. It's based on your current medications. That's how you pick a drug plan, is what you are currently taking, which drug plan covers it the best at the lowest cost. So the best way to do is go on Medicare.gov into the drug plan finder, put in your medications, and it will tell you the best plan for the total out-of-pocket cost for the year. It really is a fantastic tool. It's one of the better tools that they have. I have a video that walks you right through it. It's very easy to do once you get the hang of it. But Part D is something that takes a little bit of work. And with a Medicare drug plan, you can change at the end of any year during Medicare's open enrollment period. So there is a period of time. So if your drugs change during the year, you can then change your drug plan without any questions or medical history or anything like that at the end of each year. So just keep that in mind. It's something kind of to the side of all this related to the Medicare Part B and Medicare Part D premiums is what is called Irma. And Irma is an income adjustment to your Medicare Part B premium, to your Medicare Part D premium. And it can be significant. So you need to understand for sure how Irma might affect you. It can raise that premium, which right now on Part B is $170 a month. It can raise that to almost $600 a month. So significant increase in premium based on your income. So that's if you're making significant income, somewhere around $500,000 single or 750 joint, it can raise that premium. And if it's for you and your spouse, going from the $170 to almost $600 a month, you need to understand that. I have a video breaking down Irma completely. We're happy to help with any of that, figure out exactly where you fit in, but certainly important to understand that from an income basis. So I hope you found this helpful. That's kind of a nutshell of what changed from 2023 to 2024. And again, we're here to help with any of this. Everything that I offered to you, there's no cost to it. So if you use me to help you get a supplement, whatever insurance carrier we choose, they pay me to be your service agent now and in the future. So not only will you have me to help now, but you'll have me in the future when we need to do some changes or figure out some other things. So we just want to make sure that we get it right, certainly from the start. So everything that I offer, there's no cost. Download my book, Medicare Made Easy. It just makes things easy to understand on paper. So some people read things better than they watch things. Feel free to download my book, use information on my website, fill out the form on my website, MedicareOnVideo.com. We will email you a quote for the best Medicare supplement plan in your zip code. So quite different from North Carolina to Minnesota to California. So we just want to find the best value. We work in all 50 states. We make it as easy as possible. I hope you found all this helpful. Have a fantastic day.